Hepatitis C, presented by ASelman for Survey of Human Disease course. Introduction to Hepatitis C. Hepatitis is inflammation of the liver and can be caused by at least 5 different viruses. Hepatitis C is one of the more common forms of hepatitis. Hepatitis C HCV is a blood-borne pathogen commonly found in frequent intravenous or IV drug users, healthcare workers, sexual contacts of infected persons, and persons with multiple sexual partners. Approximately 36,000 to 230,000 Americans are infected with hepatitis each year, according to the CDC. An estimated 3.9 million Americans are currently infected with hepatitis C virus. Hepatitis C is a contagious liver disease that manifests itself with a wide range of severity, presenting as a mild illness that lasts only a few weeks to a severe, very serious, lifelong illness affecting the liver and other organ systems. Hepatitis C is frequently transmitted when the blood of an infected person enters the body of a non-infected person. Both the acute and chronic forms of hepatitis C are caused by the same hepatitis C virus, HCV. Acute hepatitis C. Acute hepatitis C infections are generally short-lived illnesses that occur within the first 6 months after contracting HCV. Most acute hepatitis C infections develop into chronic hepatitis C infections. Chronic hepatitis C. Hepatitis C is the most common blood-borne infection in the United States and worldwide. Chronic HCV infections can lead to hepatic fibrosis, cirrhosis, and hepatocellular carcinoma, HCC, and is the leading cause for liver transplants nationwide. Global impact of hepatitis C. HCV infection is a major global health issue. In 2013, it was estimated that 3 to 4 million persons were infected by HCV each year. 170 million people were living with chronic HCV infection, which caused them to be at increased risk for developing liver disease such as cirrhosis or liver cancer. Approximately 350,000 deaths occur each year, all due to HCV or its complications. Laboratory testing for hepatitis C diagnosis. Detection of antibodies to HCV, anti-HCV, is used as a screening or initial test for HCV infection. The most common form of anti-HCV testing is the enzyme immunoassay or EIA test. A positive screening test should always be followed by a diagnostic or confirmatory test. Signs and symptoms. Most people, 60 to 70%, with HCV infections are unaware that they are infected with the hepatitis C virus. These people are asymptomatic and do not exhibit any signs or symptoms of the disease. When symptoms do occur, they are not specific and include fatigue, nausea, anorexia, malaises, arthralgias, weakness, and weight loss. Other symptoms that may occur include stomach pain, dark-colored urine, fever, and jaundice, or yellow discoloration in the skin and eyes. Risk factors. There are numerous risk factors associated with exposure to HCV. Some of these risk factors are IV drug use, sexual intercourse with IV drug user, hemodialysis, being male, having a blood transfusion or multiple sexual partners, surgery, white or Hispanic race, age 40 to 60 years, needle stick injury, healthcare occupation, and being vaccinated for hepatitis B. Cost. Healthcare costs for hepatitis C are steadily increasing. Hospital charges related to the elevated hospitalization numbers has significantly increased in amount from the 1991, which was $39 million, to over $1 billion by 1998. Additionally, more than $50 million are spent on antiviral treatment for HCV each year. Treatment. The main goal of therapy or treatment in HCV infections is to slow or stop the progression of fibrosis and to prevent the development of cirrhosis. By accomplishing these two main goals, providers can help patients live longer, symptom-free lives. Treating patients with HCV infections is challenging. Many treatment options are available, but finding the one that will work and will not cause more problems than solutions is the key to treatment options. Prevention. Primary prevention against hepatitis C focuses on reducing risk of infection through safe injections and blood safety. Another step for primary prevention is continued work to develop a vaccine to protect against HCV. Education about the prevalence and incidence of HCV in high-risk populations would also be a great way to prevent the spread of the disease. The first step in reducing the burden associated with HCV infection is by identifying those who are infected through appropriate screening methods so that monitoring and treatment can be initiated. References: Disease Identification, Prevention, and Control, Hepatitis C Information for the Public, Hepatitis C Virus Infection in the U.S., Global Epidemiology of Hepatitis C Virus Infection, Hepatitis C Diagnosis and Treatment, Hepatitis C from the Mayo Clinic, and Chronic Disease Epidemiology and Control, and Emerging Options for Treating Hepatitis C Infection. Thank you.